Hello everyone, it's Phillip again, here to talk to you today about spinal surgeries for the treatment of back pain. In another video, I discussed conservative treatment options, but if you have exhausted those options and still have not found relief from your back pain, you and your doctor may start discussing more invasive treatment options. If you are considering a surgical option, I would do your research and speak in depth with your doctor on the procedure and the outcomes. First, you need to understand that every patient is different, and thus every outcome is different. So you need to understand the risks. And as most doctors would agree, the stronger you go into surgery, the better your recovery. So if your surgery is on the table, I would look into doing at least a month or so of physical therapy first to make sure your recovery is as quick and pain-free as possible. Now, on to some of the more invasive treatment options. The first one I want to talk about is minimally invasive, and most may not consider this a surgery, but I placed it in this video because it is more permanent procedure and it is invasive over a simple injection. It's called a rhizotomy. A rhizotomy is a neurosurgical procedure that selectively destroys problematic nerve roots as they exit the spinal cord. It's typically performed on an outpatient basis using a simple probe to apply radiofrequency waves to the impinged pain-causing nerve root lying between the facet joint and the vertebral body. A facet rhizotomy injection is successful in providing lasting pain relief for approximately 50% of patients. The goal is to reduce pain so they may resume normal activities in a physical therapy program. Now on to the more invasive surgeries. First, you have a discectomy. This involves removal of the herniated portion of the disc to relieve irritation and inflammation of the nerve. It's done typically with a small, less than 2-inch incision in the lower back, which then they use tools to remove the portion of the disc that is herniated. It's often common to perform this surgery with a laminectomy and or fusion. What I just mentioned, the laminectomy. This is performed by removing a portion of the bone in your spine, which will allow for decompression of the affected nerve root that is causing your pain and most common in treating spinal stenosis. It is the least invasive of the surgeries, but may still require several months of physical therapy. The success rate of a lumbar laminectomy to alleviate pain from spinal stenosis is generally favorable. Following a laminectomy, approximately 70 to 80% of patients will have significant improvement in their function and their ability to perform normal activities of daily living and a marked reduced pain level and discomfort associated with spinal stenosis. Then there are spinal fusions. Fusions require permanent removal of the disc that is herniated and fusing 2 levels of the spine above and below this disc with a bone graft or metal screws, plates, or cages. This is fairly routine and can be very effective at quick and sometimes instantaneously pain relief for the lower back and symptoms that extend down your leg. However, studies have also shown that this may accelerate degeneration of the disc above and below the fused level. Talk to your doctor. And the newest surgery on the list is a disc replacement surgery. This is being used as an alternative to the spinal fusion. If the fusion permanently restricts the motion at the spinal level, the replacement would allow for normal or close to normal mobility by implanting a mechanical device that will replace the function of the disc. This, therefore, decreases the amount of stress and degeneration on the vertebrae and disc above and below the surgical area. Since it is a newer procedure, I would seek consultation with a trained and experienced surgeon if you are considering this option. There you have some of the most common surgeries, but as always in medicine, new procedures and surgeries are being developed all the time. So talk with your surgeon about any surgery he or she is considering prior to going under the knife to make sure you understand what is being done and the risks associated with it. I hope you never need the options above, but if you do, I hope this video was able to provide you some basic information and help you. Until next time.